Hi, I'm Dr. Chelation, and I want to talk to you about concerns for heavy metal chelation and autoimmune disease. So one of the treatments that takes place when someone has autoimmune disease is they look for heavy metals. And if you have ever had your heavy metals tested, or the way the system works is you basically can have them measured in the blood, or you can have them measured in the urine. But the most common thing they do is a challenge test, where some individual will ingest a chelator, and then once they ingest a chelator, they'll do a post-urine test and they'll see what types of heavy metals are found in that person. Well, the truth is everyone has very high levels of heavy metals. So if you test it, you're going to find it. It's just one of the facts of being a human being living in modern society. You're going to have levels of heavy metal. Whether they're causing autoimmune disease or not, that's a big jump, even though we do know there's some research that links environmental exposures and heavy metals to autoimmune disease. But besides that, the key issue, however, isn't just the fact that heavy metals are linked to autoimmune disease and that everyone has high levels, is that many autoimmune disease patients will get worse, will get really, really sick if they do chelation therapy. So chelation therapy really involves taking a chelator, and once you have this chelator, the goal is for it to bind to heavy metals. But recent studies show that chelators like EDTA, DMPS, DMSA can actually redistribute these heavy metals into neurological tissue. And the biggest concern for us is that when someone has autoimmunity, is that when they go in through this chelation process, they're not redistributing metals into other areas. And there's some things that really have to be done to make sure a person is actually healthy enough to handle chelation. First of all, they should have healthy blood-brain barriers. So measuring things like blood-brain barrier protein antibodies, S100B markers are critical. Making sure the patient doesn't have intestinal permeability or breakdown of the tight junctions. You can have chemical-binded compounds get through the gut and then present as antigen-presenting cells if they bind to proteins. Chemicals can induce immune reactivity. Chemicals can bind to proteins found in blood like albumin and then cause immune reactions, and these can be significantly elevated during the chelation process. So when you're looking at autoimmunity and this whole model of doing chelation therapy as a treatment or cure, one of the things that we all see clinically is many patients get worse when they do therapy, and many of them don't recover. For some, they definitely there are some that have benefits from the treatment, but the point is that there has to be a thorough workup to make sure a person has some degree of health and is not going to have any side effects and have any risk factors for their autoimmunity when they are going to consider chelation therapy if they do have a high heavy metal load. So we're going to go over all these concepts and really talk about how chemicals impact the immune system and how chelation therapy can be contraindicated at different states of immune function with autoimmune disease patients, and really review the literature of all the various factors that are involved with chemical-induced toxicity, the Chelation Institute autoimmune program on clinical strategies and treatment applications. Hope to see you there, and thank you for your attention.